PhilHealth is calling on the business community to step up, saying public-private collaboration is crucial to fixing gaps in the country's healthcare system. As demand rises and pressure mounts, the state health insurer is rolling out reforms and new strategies that could reshape Filipino healthcare. But the big question is, will it be enough? Jin Kim has the details.
I am really appealing for all your help. It's really very difficult. But I think in the 5 months that I've been in office, meron na naman pong nararamdaman yung ating miyembro.
Before the country's top executives at the Management Association of the Philippines' General Membership Meeting, PhilHealth Acting President and CEO Dr. Edwin Mercado made a direct appeal to the business community. Help fill the growing gaps in healthcare supply, from services and facilities to equipment and technology.
It's not automatically translating to access. So that is my problem right now. Yung supply side is still lagging behind. And that's what I will be asking help. That's usually is what I'm asking help from the private sector. And we are a progressive type of social health insurance. Social health insurance means everybody has a social contract.
Mercado stressed demand for healthcare is rising, but the supply isn't keeping up. Too few hospitals, too few medicine, and too many system gaps. Among the key reforms implemented under Mercado, lifting the 45-day benefit limit, relaxing restrictions on denied claims, and expanding coverage for high-burden illnesses. Up next in the pipeline, tighter claims validation, fast-lane incentives for compliant hospitals, and a transition to shadow billing as a test run for more efficient claims processing. PhilHealth is also pushing to shift to a prospective payment system where reimbursement is based on treatment outcomes, not just the number of procedures performed.
From the private sector perspective, that's a wonderful move on the part of of PhilHealth. Why? Now, at least I have the cash on hand already rather than having to wait 90, 120, even years to get paid. Because that's currently what's happening. The delays, the controversies, the back and forth leads to frequent denial of claims, return back to the hospital, I need more information. At least this one, the money is already in our hands. It will definitely improve our cash flow scenario. The hospital business is very cash flow dependent. So it's really important that we get this done.
Beyond system reforms, PhilHealth is now focused on strengthening primary care as a long-term strategy to reduce costly inpatient admissions.
The intent is to make sure the patients are healthy such that their utilization of inpatient benefit care will go down and the savings will now be diverted to primary care. So that's a better use of our money than paying for when you get sick.
PhilHealth is targeting to expand total healthcare spending to 600 to 900 billion pesos by 2028, focused on high-burden, high-cost conditions affecting millions of Filipinos. Alongside the reforms, MAP also launched a 75 million peso fundraising initiative for working with cancer, an advocacy to support employees battling cancer while staying employed and protected.
Our goal is to launch 750 new pledges to the Working with Cancer program.
Mercado's message is clear. Healthcare is not the government's responsibility alone. While public subsidy must increase to achieve universal healthcare, active, sustained participation from the private sector, from the very business leaders driving the Philippine economy, is just as essential. Jin Kim, Billionaire News Channel.